there's a crucial component to someone moving on after a trauma bond relationship. And I'm going to talk about that in this video. I'm Dr. Seth, psychologist. And in this video, I'm going to talk more about the identity that the experience of being in a trauma bond relationship can take on, and what is the best way for you to think about that trauma bond relationship. What is the best way for you to move on from it? All right. Now, I've done a few other videos on trauma bonds, and you can certainly check those out. I just want to explain, though, that when I do videos, one of the most important points is that I do these videos to also create a sense of community for people. So you can feel free to leave comments in the chat that you may have about your own experiences. Why? Because somebody else who is struggling may get inspired by something that you have shared. You can actually be of service to somebody else in sometimes the simplest comment that you leave. And I created my channel here to create a community for people who are struggling but really want to make their lives better. Okay, so just to begin, trauma bond, what is it? So, a trauma bond is a relationship in which one has been exploited or even abused, and it is characterized by this cycle of abuse with positive intermittent reinforcement. So sometimes you do get good treatment. Sometimes you may have gotten love. You never know when it was coming, but it did come. And that sort of keeps a person in this cycle, and it keeps someone tied. Some of you may be in a trauma bond relationship right now. Some of you may be healing from a trauma bond relationship that you actually have separated from and are trying to move on from. For you listening, how long was this trauma bond relationship? How many months or years? Put your comment in the chat, because you know what's interesting? You will all be surprised by the various lengths of these relationships. You'll see that actually a trauma bond can be almost any length of time. Could be something as short as, let's say, 3 or 6 months. Yes, a trauma bond can form in that amount of time. Could be 40 years. Imagine for those of you who are in trauma bond relationships or have had such a relationship, and it's shorter. Imagine 40 years of this. Imagine someone having gone through these experiences, the turmoil, for decades. So there are all different lengths of trauma bond relationships. I want to take just a moment too and talk about the pull that one has in a trauma bond relationship. Now, for anyone who's had a trauma bond relationship, they know firsthand what the pull feels like to that person, the intensity of that bond, the intensity of that attachment. It's not something that people feel like they can easily just walk away from, right? Well, people who have someone that they love and they have a healthy relationship, it's not easy to walk away from them. Just because a relationship is negative or even abusive doesn't mean, because it's bad, that that makes it so much easier. In fact, a lot of people who have trauma bonds will tell you it's a million times harder. So this pull, I want to be someone who can just sort of say some of the words associated with what it can feel like. It feels like a draw. It feels like a magnetic pull to that other person. It can feel like you feel pulled, compelled to be close to them, almost like you don't even have a choice. It can feel like the magnetic pull is that strong pulling you. Now, one of the things that's confusing is in some really dark emotional moments, you may feel like, well, we're born to be together, or only that person can really, truly understand me. And it's really important in those moments when you feel that, because you may confuse the pull, you may confuse the draw, the connection, as if that is a positive thing. And yet, really, it is born so often out of pain. It is born out of that intermittent positive reinforcement, never knowing when the good love or the good treatment can come. And so it makes total sense to be on high alert and hyper vigilant and connected and attached to that person, because maybe in the next moment I will get love. Maybe tomorrow, if I just hang in there, if I watch them closely, if I try to do everything that I can to get on their good side, maybe I will get love. So you become so dependent on them in these moments, totally understandably, as much as this overall cycle can be so harmful for a person. All of this brings us to a crucial question, which I believe is incredibly important for a person in terms of moving on from a trauma bond. So, if you have decided that this relationship is simply not bearable for you anymore, or if you're already out of the relationship and struggling to actually move on, I want you to think about this issue. I once heard someone say something that really got me thinking, and it's this: victims don't recover. Victims don't recover. At first, I think that this notion can sound incredibly insensitive. Who is someone, especially someone who hasn't had the same traumatic experiences, to tell somebody else victims don't recover? So, on the surface, that I think is a really wild and preposterous argument to say something like that. And at first, I think it can sound like, wait a minute, is this minimizing, diminishing a person's experience, a person's really painful experience? But here's the idea behind that. And this is why a lot of victims' rights organizations, a lot of people who have been victimized in various types of crimes and experiences will say that actually they prefer the term survivor. They prefer the term survivor because survivor connotes a notion of strength, of empowerment, of having lived through something and living through to be able to talk about it. And you know what? Also, possibly even be able to help others and do a service to others by talking about it. On the other hand, the term victim can connote for some helplessness or passivity. The thinking is that the shift from victim to survivor, that shift is one that supports agency. Agency, your own agency, your own ability to make good decisions, to take care of yourself, to say, no, I draw the line. I draw my boundaries at this. I will not tolerate behavior that includes, and then the whole list of negative behaviors, the ways that you may have been exploited in that trauma bond relationship. You did survive it. And I believe that it is this sense of agency and surviving it, and also mixing it with the sense of, let me be of service once I get out of this to help others, to talk about my experience, so that maybe all of these experiences weren't for nothing. Sometimes some of the worst experiences that we can have, if we can find a way to do service by talking about it with others, it can give them meaning. It can make some experiences that felt like just a waste of time, it can make them actually serve a purpose. My final question for you watching is, which of these ways to talk about it fits you best? What works for you? That's what really matters. What works for you? What term or words make the most sense for you, so that you don't have to feel stuck in anger that might hold you back, so that you don't have to feel potentially stuck in bitterness, or worse, that sense of helplessness. I believe you. I believe we all have agency. We all have the capacity for empowerment if we can just tap into it and treat ourselves well. I'll share some examples of some things that you can say to yourself. Ask yourself which one of these works best for you. And you can share your answer in the chat. Maybe something that you say could be of service to somebody else struggling too. Here are some examples. I was victimized in that relationship, but I grew from it. Or I was victimized by that person, but I am not a victim. I am not a victim. I'm a survivor. What words fit you best when you think about your role? All right. Think about this. I hope this video has been helpful. I also hope you might find some other videos, either my videos on trauma bonds or some of my other hundreds of self help videos available for you, ones that you can connect with that you might get a little comfort or some tips from. All right. Take care, everybody.